Well, joining me now with more insight on all these developments is Dr. Kate Tulenko. Dr. Tulenko is a physician and the founder of Corvus Health, a company that focuses on solving healthcare workforce challenges. She's also an adjunct professor at the Johns Hopkins School of Public Health. Kate, welcome back.
Thank you.
So let's start first with the emergency listing approval for China's Sinovac vaccine from the WHO. How important is that endorsement for the global fight against COVID, and especially for poorer countries?
It's important because it gives us another set of vaccines and another set of manufacturing facilities that are going to be producing vaccine, because right now the real problem is supply. And many of the Chinese companies have been willing to license out their vaccines to manufacturing plants in other countries, so that could potentially expand the supply of vaccine even more. And also, since China and most of the pharmaceutical companies from China want to join COVAX, we can expect that their vaccines are going to be made available through COVAX.
And do we know how quickly that we might see the benefits of this decision?
It's hard to know. It really depends on how quickly they can ramp up the vaccine production, and also there's the distribution as well. We know that logistics have been a challenge in addition. And one of the challenges that people have been talking about recently is that in Africa, many people have received the first dose of the vaccine, particularly the AstraZeneca vaccine, but the second dose isn't available. And we have to realize that public health leaders were making decisions about situations that really have not occurred in modern times, and trying to decide, if you have 10 million doses, is it better to give 10 million doses to 10 million first doses to 10 million people, or should you hold them and give 5 million people their first dose and then 5 million people their second dose? I think the right decision was made by focusing on giving the first dose, because with all the vaccines, it has been shown that the first dose does indeed confer some immunity.
So then, given these different bottlenecks, then, how do they overcome these current challenges with getting vaccines to those who really need them?
It really is going to be about ramping up that supply. And it's a challenge with the Moderna and the Pfizer vaccines because they are mRNA vaccine. This is a technology that's never been used before in commercial vaccines and is more advanced. So many countries don't have the type of facilities which could manufacture these vaccines. However, the Sputnik and several of the Chinese vaccines use more traditional vaccine preparation technology. So we do know that there are vaccine manufacturing plants in Latin America, Africa, the Middle East, and Asia that could produce these vaccines in larger quantities and get them out to the people who need them.
So for some of these locally produced vaccines, what sort of infrastructure, what sort of support do they really need to be as effective as possible?
They need the infrastructure in the forms of the equipment, the manufacturing equipment, the sterile rooms. They need the supervision, the scientists, the lab scientists, the pharmacists, the chemists to run it. These are very skilled people. They need the refrigeration facilities. They also need all the other supplies, such as the glass bottles, the rubber stoppers, to get the vaccines out. So it really is an extremely complex process.
And we know that COVAX is seen as central to getting the vaccine out more equitably, and we've seen lots of countries pledge their support in recent weeks. What have been the key benefits and challenges with COVAX?
Well, COVAX creates a level playing field, because without COVAX, you have countries bidding against one another and driving the price up. But COVAX sets a price, it creates a marketplace, and it also creates a place in which any country can purchase the vaccine for a given price. And so that marketplace creation is important. And it's quite interesting because we also have seen some private sector markets set up as well. For example, Russia has decided to sell their Sputnik vaccine on the private market to Egypt and some other countries, for example. So we do see these private markets, but COVAX has created a trusted set public market for vaccines.
Now, you touched on the global conversation about intellectual property waivers from vaccine producers. We know this has been a very divisive issue, and as you mentioned, potentially China could license out its vaccines. What sort of progress are we seeing on these fronts?
We haven't seen much regarding Pfizer and Moderna. President Biden indicated that he was willing to release the patents, in that the U.S. had funded, a great deal of the production of those vaccines, but Europe has been more hesitant to release that intellectual property. It does look like several of the Chinese manufacturers are more willing to release their intellectual property, so that will enable other manufacturers to produce the vaccine and really increase the amount of vaccine available. But we're also, I want to mention, seeing countries that no longer need as much of the vaccine make their doses available. For example, New Zealand has really been able to control their outbreak by public health measures, by lockdowns, by social distancing. So they don't need the vaccine that they purchased, so they're making it available through COVAX.
And as we are seeing some of these countries get to a better rate of vaccination, what do you think could really incentivize people who perhaps are still wary? Obviously, we've seen things like lotteries and things to really incentivize people. What do you think could be really effective?
I think in the low and middle income countries, we don't need that now, because I think there are large percentages of people who want the vaccine. We only need that right now in the U.S. and Europe, where we already have high rates of vaccination, and we're trying to get the more reluctant people. But when we reach that stage in low and middle income countries, I think we'll need the same techniques. We'll need to reach out to community leaders, to religious leaders, to speak to their communities, to have photos of themselves being vaccinated, but also some of these other things, like the lotteries and the other prizes, because I think those will work in the low and middle income countries as well.
All right, thank you. Always good to get your insights. Dr. Kate Tulenko there, physician and the founder of Corvus Health.